Okay, so let's talk about lumbar disc degeneration. So when you look at these different examples here, they show you everything from textbook normal on through to what's called phase 3 degeneration. So the first thing you want to see about when you're looking at lumbar disc degeneration, which again can be a cause of low back pain, you should see nice thick cushions between the bones. So here's where it's healthiest. You'll see this cushion between the bones is the thickest here. When things begin to become problematic, the first thing that'll happen is the disc will start to get a little bit thinner and compressed compared to this. This is called disc desiccation, and basically what it means in a nutshell is the disc is starting to dry out. It doesn't have the same amount of content inside of it as it used to have. That can happen for a number of reasons. You can have an old injury, you can have joints that aren't moving properly, you can have joints that have been overused. You could also have joints that aren't loading properly, and because they're not loading properly, they're putting undue pressure in areas. There's lots of different reasons why it can happen. Okay? If that stays there long enough, then the next thing that happens is the disc gets thinner and thinner, and the edges of the bones start to become rough and jagged. These are called things like bone spurs, osteophytes, lipping, spurring, calcification. People will throw lots of different names around there about that, okay? But what you'll also start to see is these nerve roots that come out from the sides of the bones are actually starting to get a little bit of atrophy on them. So they're actually getting a little bit thinner, and that's all part of that deterioration process that goes on there. And then finally, when somebody is all the way over here in phase 3 of degeneration, you can see there's hardly any visible disc left between those bones. The bone spurs are all basically starting to rub on each other, and there's a chronic pressure on these yellow nerve roots that are coming out of the sides of the spinal cord. That constant pressure on those nerve roots is really what causes people to have a significant amount of chronic low back pain. When you start to go down this process here, oftentimes people will describe things like a dull ache in their back that's maybe worse first thing in the morning when they get up. It improves a little bit as they get going throughout the day, but then they almost hit this threshold maybe around 2, 3, 4 in the afternoon where they've been on their feet too much and they have to get off their feet. Walking on hard concrete floors in places like grocery stores and shopping malls can be very hard on people who have degenerative disc disease. There are great strategies from a chiropractic perspective to be able to create improvement in here. Some of those strategies are going to involve chiropractic adjustments. Some of them are going to involve mobilization. Some of them are also going to involve stabilization, depending on what the person needs specifically. So this is a great opportunity to say, what are you doing to help yourself? Because the reality is just covering these up with things that mask the discomfort is not going to slow the progression of this process. You want to do everything you can to help yourself slow the progression of this, and when possible, even create some healing in those areas as well.